Thank you, Robert. You point out frequently the differences between this administration and the previous administration. With the latest recess appointment, the obvious question is, why do you simply not wait for the confirmation process to go through and submit it to a Senate when they schedule a hearing before the appropriate committee and make recess?
This wasn't a hearing problem, right? This is, we've had plenty of nominees that have had hearings that wait months and months and months and months before the Senate will be allowed to take it up. And when I mean be allowed to take it up, meaning simply getting unanimous consent to have a debate and a vote. Sometimes after 10 months of waiting, that unanimous consent is gotten and the approval of the nominees is unanimous. And then one simply wonders why we've waited 10 months. The health care law...
The Senate was too slow on Berwick is what it is.
I will say that there are those in the Senate that had no intention of dealing with this nomination other than to play the political game.
But how do you know? Are you that cynical with the process already? You don't want to get the, you don't even want to see it play its way through?
I'm not a cynical person. I just have ample evidence. 21 times. 21 times. Let me compare the Bush administration and the previous administration and find a break. On 21 occasions, unanimous consent was blocked in order to, and cloture had to be invoked to get somebody a vote. 21 occasions. In the first year of the Bush administration, how many times did that happen? How many times did that happen? How many times did that happen? Fred, how many times did that happen? How many? Zero. Zero. Yeah, guess what? Both of you knew the answer to that.
Did the chairman ever ask the chairman's office for it here?
Did who?
Did the president ever ask the
Not to my
chairman
knowledge.
Well,
Yes, sir.
Robert, on Israel and Iran...
Excuse me, Robert, how can you complain then about the process when the president...
Because, as I said, this wasn't a hearing. This wasn't an issue about a hearing. This is your latest attempt to decide that the process was being upheld because there hadn't been a hearing scheduled. The hearing wasn't a problem, right? There would have been a hearing. He would have gotten out. And guess what? Months and months and months would have passed before anybody would have consented to simply taking up the nomination. Now, we passed a law, Healthcare Affordable Care Act, that has to be implemented. There are things that have to be implemented by the first of the year per the law. We are not going to wait for those in the Senate that want to see this delayed and delayed and delayed before something, let me finish my answer, before this is taken up. Now, I know there's these grand conspiracy theories, right, that somehow the American Medical Association, the American Hospital Association, the American Association of Retired Persons, Mark McClellan, and Tom Scully seem clearly not to be complicit in supporting somebody amply qualified to run CMS and to implement the law. And that's what the president sought to do.
Have a hearing where all of that can be decided in July, and if there's a blockage of recess, appoint him in August.
Because we're not going to...
The calendar that you just described would not be affected by that. He'd still be in place.
Absolutely. What's today? July 12th. We got 3 weeks until August. We're going to implement the law, Major. We're not going to wait around.
You had a hearing in July and recess appoint him in August. Why not?
We're not going to wait around for the same old people to play the same old political games time after time after time. We're just not waiting around